Vet here. Hope you're very, very well. In the UK, it's incredibly cold. Got in the car this morning, -6 degrees, to go and take my car to the garage. Couldn't believe it. Really, really, really horribly freezing. Tomorrow, I am going to be traveling to Tallinn, which is the capital of Estonia. And while we are there, I'm going to be talking on Saturday to vets and the general public and to raw store owners, all about the joys of raw food. Really can't wait. Should be great. But this evening, we're going to be talking about food and joint and bone health. So it's I cannot overemphasize the importance of this topic. Okay, you know what they say: the two things that are guaranteed in this life are death and taxes. Well, I would add to that: death, taxes, and arthritis. If you're lucky enough to reach your grand old age, and your dogs and your cats, we will get arthritis. And so we're going to be talking about this very, very, very important topic. If you have pets, then as they get older, you will absolutely see them slowing down, getting creaky, where once they used to shoot up the stairs. Now they're maybe needing a bit of a hand to get up the stairs. They used to be able to jump in the car easily, and now they are really not. So arthritis, massively important. Any joint in the body can become arthritic. If they're static joints, it doesn't really matter so much. You've got plates of the skull, and so they aren't really affected by arthritis. But all the moving joints in the body, even your vertebrae, which are semi-static, but there is mobility there, if they start getting ossified, osteoarthritis problems, then you will know about it, because arthritis, by definition, arthra refers to the joint, itis refers to inflammation thereof. So we've got lots to go through this evening, so I'm going to jump straight on. Laura is with us. She's watching what's happening. So I'm going to do the magic screen right there. So I'm going to stay with you down here, and the slides are going to be up above so that you can see them. So I'm going to go over to here, to our first slide, and hopefully you can see my first slide there, and that you can hear me talking. I'm just going to wait for Laura to say yes, she can. She can. Yes, great. So we're jumping in quite quickly today. This is the Gut Doctor. My name's Nick Thompson, and really want to thank Vomex for allowing me to take time out of my day to prepare slides to share the beauty of gut and general physiology, biochemistry, health, microbiome health, all these sort of things. They're very, 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 very important. And it's just very exciting to be able to share them with you. So there we go. The Gut Doctor. This is a monthly show that we do. And next month, we will be on the 22nd of February, and we are going to be looking at diet and disease. So there's going to be some philosophy, there's going to be some biochemistry, there's going to be broad view, and some real detail there as well. Really looking forward to that. Diet and disease, 22nd of Feb. Please come and join us. I'm going to jump straight in, guys, because there's lots to look at. We are going to talk about food, but there's just a few really, really, really key points that I'd like to go through before. I've got far too many slides, so I'm going to just rattle through just a little bit, because I don't want to detain you too much, says he who always overruns. But there we go. So Feeding for joint and bone health. This is an interesting title that Laura and I came up with, because most people think, oh, arthritis, that's just about joints. But actually, we need to look at bone health as well. In humans, we see we see arthritis, but we also see osteoporosis, for example, is a phenomenon. So bones and joints go hand in hand, and we're going to be talking about how to keep all these elements of your skeleton healthy. So osteoarthritis is one name for it. Degenerative joint disease is another. Plain old arthritis is another. Humans get a thing called rheumatoid arthritis, which is an autoimmune disease where your body actually attacks the elements within the joint. We don't see that so much with dogs. So I'm not going to be talking about rheumatoid. We're going to be talking more about degenerative arthritis. If you have a cracking injury in your youth, or your dog gets run over or kicked by a horse or something like this, those joints that are affected in youth will often be the first ones that are affected later on in life. However, if you've looked after yourself and you have not had any major injuries to the joints, then there will still be arthritic degeneration because tissues age, they oxygenate less effectively. The circulation, which we're going to talk about in a bit, will reduce, and so there will be a more kind of generalized arthritic pattern than, oh, I've got a really bad shoulder, I'm 70, I've got a really bad shoulder because I got kicked by a horse when I was young. Okay, so this is how it goes. I'm going to be interchanging between human and dog arthritis, because essentially we're very, very similar in many regards when it comes to arthritis. So what causes arthritis? The causes: genes, nutrition, and exercise. These are the main factors. Of course, getting kicked by a horse is going to be causal. So trauma is there. But if we're just looking at the kind of the fundamentals outside trauma, then your genetics, your nutrition, and your exercise. We're going to be looking mainly about nutrition, but we need to just bear in mind these elements. So what is degenerative joint disease? What is arthritis? Okay, so on the left there we have a normal joint. Could be a finger joint, could be a wrist joint. Well, it's a bit too simple for a wrist joint, but you know what I mean. It's just where two bones come together. And fundamentally what happens is that Mother Nature has given two at least two levels of cushioning and softening and lubrication to moving joints. The first thing she does is she puts a smooth, slightly soft but very firm layer over the bone so that you don't get bone on bone grinding, which is obviously going to hasten decline massively. And we call that cartilage. Different types of cartilage, but for now we don't need to worry about that. We've got cartilage there. But she goes one stage further, and rather than allowing cartilage on cartilage to rub against each other, she has very cleverly put synovial fluid, which is an ultra lubricating fluid which comes from the synovial tissue in here in red on the left hand thing. So you've got this tissue and it just kind of oozes this very, very, very um, um, slippery, much denser than water, much more viscous than water, and that, because there's a certain pressure within it, keeps a layer of lubrication between these two very, very, very smooth surfaces of the cartilage. What happens when these things break down? Right. Well, one theory is it's just wear and tear. Another theory is that you get inflammation when you overuse joint. So your fingers will often go as humans, your hips and stifles will go as with dogs. The other theory is quite interesting, is that we see a breakdown in joint integrity because of a reduction in oxygenation and circulation to the joints, which is not something that um, modern medicine really looks at very carefully, but I think is very valid and does play into some of the herbs that we're going to be talking about later. So as we see with the image on the right, we've got destruction of bone and cartilage, yeah, and the joints become a little loose. Um, there is inflammation. You see, you've got a narrow red on the left and on the left hand image, and then on the right hand image, we've got inflammation of the synovium, these synovial fluids, and it affects the quality of the synovial fluid as well. And so when you put all these things together, you get what was a beautifully functioning, clean and smooth system goes into something that kind of resembles a ball bearing that's had sand put into it. There's a bit of crunch, there's a bit of grind, there's pain because of the inflammation, there's reduction in mobility, and these are things that we all know about. But these are the physiological changes that we see within these structures. This is the right hand elbow of a dog, and this is a healthy joint. We're not going to go through the anatomy, but you can just see that the lines are clear and clean and smooth. The joint where we have the humerus there runs into the ulna, the bone at the bottom, which makes the major part of the cup for the joint, is the ulna. You can remember that because the ulna is under the joint, and then we've got the other bone there. It comes along and helps and cups, and that's when these move together. Then we have a secure, stable joint. There are soft tissues on both sides, on the inside and the outside. We call them the medial is the inside and the lateral is the outside of the joint, and they stabilize. These are the kind of soft tissues which you damage if you've got a skiing accident within the knee. So you've got to look after those. So there we go, the ulna, and there's the radius, and they work together. This allows you to rotate your forearm, and dogs have a certain amount of that. It allows them to grasp a bone, for example, and chew that bone. Humans are very, very clever because they're able to rotate massively, and which makes us very, very dexterous. Monkeys have a similar degree of that rotation ability. So when things go wrong, you can see that the joint is no longer, the space is no longer even, and you can see there are kind of fluffy bits towards the outside. This is where we've got bone has been inflamed, soft tissues have been inflamed and then calcified. And you can just see, I think you can get a good feel for the fact that that joint is going to be pretty sore. It's interesting though, with x-rays, the degree of change that we see on an x-ray is not always proportionate to the amount of pain that we get with a dog. So for example, if you have 10 dogs lined up in front of you, and you line them up from the least arthritis to the worst arthritis, and you get their x-rays, say of their elbow, if they're all elbow arthritic, the line of X-rays will not tally with the line of the degree of arthritis that those animals demonstrate. Okay, it's going to be fairly close, but it's not going to be that accurate. I've seen some absolutely terrible looking joints on X-ray, but the dogs come trotting in, and they're doing well with very little support. So this is interesting. This is interesting stuff. Genes. I just thought it was a fantastic photo. Um, I was going to say there's not a lot you can do about your genes, but if you're choosing a dog, then I think looking for good bloodlines. If you just go to the dog pound and you get a dog, then you have to just go with what you've got. But we're going to move away from genes just in the knowledge that there is genetics. If one of your parents was very prone to arthritis at an early age for no good reason, then you may go down the same line. That's a fairly well-known phenomenon. Weight. We can't talk about arthritis without talking about weight. One of the most influential things that you can do for your dog is to reduce their body condition score. Ideally, I like my raw-fed dogs to be about a body condition score of 4. Okay, this is a scoring system that goes from 1 to 9. 5 is in the middle. If you talk to the big food manufacturers, they all say, "Yep, 5 is where you need to be." I think that a little lean and mean is a good idea. I'm not talking skinny. I just mean that you can feel the ribs, but you can't see them. Is a good rule of thumb. Now, you can have a look. If you're not quite sure about body condition scores, you can have a little Google. It's called BCS, Body Condition Scoring, and there's lots of diagrams that you can find there, and you can have a little exercise to work out your dog's honest body condition score, because weight is not always a good indication of is my dog obese or is my dog not, whereas body condition score is an absolute marker for whether the dog is in the best of body conditions. Remember, 4, slightly lighter than the midpoint is where we need to be, and that will be very influential in the development of arthritis. So if you've got a dog who stays at about body condition 4 for their whole life, they may have much less problems later on. But if you've got a dog, I don't know, they're a 10-year-old Labrador or Springer Spaniel or something like this, and they have got arthritic changes, and they are a 6 or a 7 on the body condition score. If you can get them down to a 4, and the easiest way to do that is with a raw or fresh food diet, then that will have a massive impact. And even some dogs will be able to come off their non-steroidal anti-inflammatories, the Metacams, the Previcoxes of this world. So weight is really quite important in this realm. The other, and this is kind of apropos of nothing, but I just have to say it because it's so important, is if you're raising dogs for the first few years, if you've got beautiful parquet flooring like this, it's an absolute nightmare for good joint development. This dog is a great body condition, and he's not in the first flush of youth. I would say probably, I don't know, 7 or 8 years old. But if you've got parquet flooring, if the dog gets up any speed whatsoever and they go around a corner, they're just going to lose their legs, and they're going to tumble. They can splay. If you've got older dogs, then shiny, slidey floors are an absolute nightmare. And I'm afraid it is a very good idea to get some rugs and put them down so that they have better footing. It's a tiny thing to implement, and doesn't cost very much relative to surgery for arthritis and what have you, but can make a massive difference. There's just a little tip that could be very influential and doesn't require a vet visit either. So there's a goodie. Now, other points that always go through my mind when I'm talking about arthritis and degenerative joint disease is we don't use our osteopaths and our chiropractors and our physios enough. Any dog I see, if there is the slightest asymmetry, I will send them along to an osteopath or a chiropractor. This is my mate Tony Nevan, absolutely lovely guy, gifted beyond belief, and he does people, but he does a lot of canine work as well. We've just got a new puppy, a big lurcher puppy who's about 5 months now, and he's got slightly sore back, so we're going to be whizzing off to Tony sometime very soon. Tony, such a good bloke. When he's not working in the UK in the summer, he'll zoom down to Africa, and this is him working on an elephant with osteopathy. If you want to have a look at his work, he's got a lot of vids on YouTube and things. His website is Zoost, zoo as in zoological park, ost as in osteopathy, zoost.com. He's not the only osteopath, canine animal osteopath in the country, but he's based in Cheltenham, but he does travel around the south of England. But just a fascinating guy. If you haven't got an osteopath or chiropractor, I would suggest it's a very, very good idea. Our post-surgery for any animal at any age, and if you've got the slightest suspicion that they may be asymmetric, then osteopaths, chiropractors, worth their weight in gold, methinks. You can just do a Google search or talk to your vet, and they will, if they use chiropractor, osteopath, then great. If not, talk to the people in the park and just see if you can find out somebody, or you may be able to contact Tony and say, listen, I'm in Dumfries, who would you recommend? There's Mary Monroe is an osteopath. She's in Edinburgh, and the other osteopath I use, and I've got nothing against chiropractors, but the other osteopath I use is Nadine Hobson, and she's in London. Absolutely fabulous. She's treated me in the past, and she's very gifted again. So this is him. This is how I met Tony, actually. I saw him when I was junior vet, and I was working. I was actually seeing practice before I was even qualified. And this guy used to come along and treat the birds of prey. I was working with Neil Forbes, an amazing bird of prey specialist vet, but Tony Nevan would come along if they'd damaged themselves somehow or flown into a wire or something like that. Then he would come along and help to rehabilitate them. That's just how sensitive and gentle his touch is. So there you go, Tony Nevan. Other osteopaths are around, as I say, Mary in Edinburgh and Nadine Hobson in London. Okay, don't forget, acupuncture can be very, 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 very useful. More and more practices are doing it, and acupuncture, don't be scared. Not every dog in the world, not every cat in the world will accept, but I would say 8 out of 10 dogs and cats will accept to a greater or lesser extent the needles. They're tiny needles. They pop in very, very easily. I used to do a lot of acupuncture, but nowadays I just find I'm so taken up with herbs and raw food and health through those media that I haven't got time for acupuncture, which is a shame because it's a lovely thing to do. So there you go, acupuncture. Don't forget the acupuncture. We've also got hydrotherapy. Nowadays, we've got stem cell therapy as well. These are things that I would definitely look into if your dog is having problems with arthritic issues. Okay, so let's get into the nitty gritty. We're running over time. I apologize, but I don't really, because this is fun. Okay, we'll talk about diet. So I'm just going to keep it fairly simple on the diet front, because there are some certain key issues that we really, really, really have to have to encounter, we have to discuss. So marine oils would be my number one. These are sardines. Sardine oil, you can get it online. I like sardines because they're small, they're cold water, and therefore they have low mercury toxicity. Mainly, ask the manufacturer if you're not sure. Omega-3 is the anti-inflammatory oil, fatty acids that the body desperately needs in order to maintain a reduced inflammatory state. Most dogs, most cats, most humans, because of the modern world, live in a more inflamed state than we did, say, 500 years ago, before ultra processed food came along, that's for sure. And we often don't take enough omega-3. So anybody watching, marine oils, really fantastically useful. Marine oils are good for skin, they're good for joints, they're good for hormones. So these are an easy win. Sardine oil is fantastic. Krill oil I love as well. I usually alternate a sardine oil for a month, and then we'll go krill oil for a month, and then herring oil is really fabulous as well. There are various oils. We use salmon oil. We always use non-farmed salmon. We'll use wild salmon where we can get it. And it's just an easy win. Even if you're feeding kibble, to feed an extra marine oil daily, keep it in the fridge, buy small batches, finish those after a month, and then alternate those marine oils. I think you can't go wrong. Absolutely great. Really good. Helps to calm the dog. Anti-inflammatory, good for all sorts of things, as we've mentioned. So if we're talking about omega-3 fatty acids, we have to talk about omega-6 fatty acids, because omega-6 fatty acids are pro-inflammatory, and most Western diets, and definitely kibble diets for dogs, and the standard American diet for humans, has vastly too much omega-6. And if omega-6 is pro-inflammatory, that means it's going to push you in that direction, which means it's going to predispose to arthritic problems, to IBD issues, to psychological issues, to Alzheimer's, to cancer even. This is a presentation by him. It's about 45 minutes long. He's Dr. Chris Knobe, as in Obi-Wan Kenobi. Okay, Dr. Chris Knobe. You can look him up on YouTube. There's the link there, but the easiest way is just to go to YouTube and put in Dr. Chris Knobe and look for that image. That's pretty much what you'll see. Yeah, black background, white shirt, dark suit, and that will give you 45 minutes, which is very entertaining. He does a bit of historical stuff, and it's a real game changer. So check it out. It's really good. In a nutshell, avoid seed oils. Okay. If you do a little Google search or YouTube search on the hateful eight seed oils, then the top 8 seed oils that 20, 30 years ago we were told were all great for you turn out to be pro-inflammatory disasters, which you need to get rid of in your kitchen and get out of your dog's life. Very important. Again, it's an easy win. Once you understand, we just avoid these seed oils. So there you go. My top tip for the evening is Dr. Chris Knobe. It's a really stupendous presentation. Okay, if we're talking about joint and bone health, that is not a baseball cap, that is liver. Okay. It's the only one that I could find that wasn't really gory, because some people are vegetarian and what have you. So that's a diagram of a kind of a cartoon of a liver. And the reason I love liver is very high in vitamin D. and vitamin D for your dog and for you, massively, massively important. And it is very high in iron and zinc and magnesium, all these things which are very influential in bone and joint health. And vitamin D, massive. Vitamin D, everybody knows vitamin D. You make it in your skin from the sun, and it's good for kind of calcium and bone health. But it does so much more than that. It's a fascinating hormone, a fascinating vitamin. Is it really a vitamin? Because you can make it, which is why I said, is it a hormone? Anyway, very interesting. If you don't eat liver and you you can bring yourself to eat it, it's a very, very, very good. I try and eat a liver type product at least once a week these days. Okay, so let's talk about herbs. I'm not even going to mention raw food or fresh food. Fresh food is just lightly cooked food, because that's a passion of mine, and I'm not going to bore you with it. But if you want really good, healthy dog with great, healthy joints, then going raw is great. It will help you lose weight with the dog and will supply all that goodness. Liver is part of that. Obviously, there's bone in there. There's cartilage in these minces that we use. If you're feeding raw meaty bones, then you've got bone and cartilage going in there. So it's fantastically useful. So it goes without saying that if you can go raw, do. If you can't, or for some reason, then fresh food is great. If you can move off kibble and canned and pouch food, then you will do your dog a massive favor. This is the joint support blend that we formulated about a year ago, probably more, 18 months ago, with our friends at Vermex. I'm just going to use it as an example of some of the herbs that we use within this blend. Organic as well, which is great. Turmeric, chia seed, ashwaganda, ginkgo, linseed, hemp seed, gotu kola, ginger, black pepper. That's the total. But let's break them down a little bit. What are the anti-inflammatory herbs? Most herbs have an anti-inflammatory element and an antioxidant element, but these would be the big ones. So turmeric, very, very powerful. It's antiviral, it's antibacterial, it's great for the gut. It is strongly anti-inflammatory within the gut, but also when it gets into the bloodstream. So that can be very useful. Golden paste, for example, these type of products can be very useful in our arthritic patients. Chia seed is a mild but significant anti-inflammatory, especially within the gut. If your gut is unhappy, then your immune system will be unhappy. If your immune system is unhappy, then you can get problems with inflammatory disease. Arthritis is an inflammatory disease. The last one is ashwaganda. Withania somnifera is the name of the herb, and it is quite a potent anti-inflammatory. Okay, so what else have we got? Circulation. We talked about one theory of degenerative joint disease is because just the blood and oxygen and the nutrients are not getting to those joints, and so they kind of give up the ghost. So within this product, we worked really hard to make sure that we had great circulation support, and I think there's quite an unusual within a joint support supplement. We've got turmeric has this circulatory enhancement. Ginkgo, I think many people know about ginkgo. People use it with if they've got Raynaud's disease, or if they some people will use it to help with early dementia, things like that, because it is known to improve the circulation, especially to the brain. So it improves circulation generally. It's super safe, as is turmeric and all these herbs that we're discussing today. But it gets that circulation moving really beautifully, as does ginger. Ginger helps to stimulate in a good way the gut, but it does have this circulatory warming effect. The Chinese were really big on ginger, especially in the winter. So that's a great one to use. And black pepper also has this um, pro circulation stimulation effect, which is fabulous. We also, and again, this is quite an unusual addition for a joint support. We've got chia, linseed, and hemp seed in there. Why is that? That's because if your biome is unhappy, you will be in a much more pro-inflammatory state. So chia seed, linseed, hemp seed are in there. There is prebiotics, and they will help to normalize, regulate, feed all the good bugs within the gut. So that's why we use those things. And it's, yeah, though I say it myself, I think it's a fabulous, fabulous product. There you go. And then what have we got? Now, these elements are very interesting because they are to help strengthen the whole body of the dog. Ashwaganda, Withania somnifera, is known as strength of a horse in the Ayurvedic tradition. Okay, so this is to do with, let's get the dog stronger overall, because when you're stronger, you can exercise. When you're stronger, your joints are stronger. They can look after themselves much, much better. Gotu kola is another of these kind of gently strengthening herbs. It's Centella asiatica is the Latin name, and it's all about let's be gently stronger than we could otherwise be. Fabulous combination of thing, though I say it myself, and that's why we put these elements within the within the joint support blend. So there we go, and we're done, and I'll come back on there and just have a little look. So nice to be back with you, and I'm just going to see if there are any Jane is a great supporter of the show, so we really appreciate that, Jane. I'm just going to put that there. So she said she used to play hockey and squash, and she's feeling it. I imagine her lower back is a bit bad because of running around the hockey field, and maybe her shoulder and elbow is a bit rickety because of the squash. But I would imagine, Jane, you're in much better fettle because of that exercise earlier. Great diet, great exercise, guys, is the key to health and happiness. So that's nothing that you don't know already, but I'm going to say it anyway. Oh, Wendy. Thank you, Wendy. Are they Labradors? It's a tiny little picture. Oh, it looks like you on your wedding day, and you've got your dogs there. So that's great. Thank you, Wendy. Great to see you're here. Karen, friend of the show, is here. Okay. What do we got? Okay. Okay. So Karen, and I didn't bear to say this, God bless her, said, my companion massage therapist said that slippery floors are her most hated thing. Need to get a nice non-slip rug. Yeah, you can get them for tuppence halfpenny from Amazon or B&M's, or wherever you might get them. So absolutely great. Martina is from the States, and she is with us. So Martina, greetings to you. It's great to see you. Here's a testimonial. Jane went along to see Tony, and she thinks he's the bee's knees, as do I. Oh, okay, great, nice point. Laryngeal paralysis, not arthritis, because it's to do with the cartilage and the nerve supply to the larynx here, the voice box. And Karen is an expert on laryngeal paralysis. Her old dog used to have it, and so she did a very deep dive and gave a wonderful presentation in Helsinki last year. So really, really great. Oh, and again, this is turning into the Tony Nevan fan show, but I'm okay with that. Okay, this is good. Yeah, Martina, acupressure, great. Yeah, you can, if you see where the needles go in when you go to the acupuncture vet or the acupuncturist who works with the vet. Oh, look, got a thumbs up. You can use acupressure in those points as well. It can be useful. You can use it at home. The other thing is there is a thing called a photizo laser, which a lot of people are using more and more these days. So that's a great one to look into. What's Penny? Penny van der Merwe. I hope I pronounced that right. She's in South Africa, and I met her in Helsinki actually. And again, another great supporter. And I didn't even read. And please read the ingredients of the supplements and avoid fillers and additives. Yes, that's another show that we've done on Gut Doctor. I'm seeing over and over again that supplementary things are being sold or packed with fillers which contain sunflower and flax oil, which something which negates the effects of the omega-3s. Yeah, they can. It's avoiding the hateful eight. Yeah, do a little bit of research. Have a look on the hateful eight. Kate Shanahan is the originator of the phrase the hateful eight. Kate Shanahan wrote a wonderful nutrition book called Deep Nutrition. Yeah, dark blue cover, quite a tome to get through, but life will never be the same again once you've read that. Okay. Oh, Michelle Bettany is with us from New Zealand. So fantastic. I spent a year in New Zealand, 14 to 15, went to Auckland Grammar. So there you go, Michelle. Great to see you there. Okay. So not a lot of questions, guys. So, but a lot of positive input there. I imagine you can see those, so you can share those thoughts as well. It's great to be here. Sorry, it's been 42. I'm not really sorry, but I'll say it anyway. So next show, 22nd of February. Diet and disease. It's going to be a real goodie. So come and join us then. It's great to see you now. I'm going to leave you so that I can go and pack, get me dinner, get to bed early because I'm leaving at 5 o'clock tomorrow morning for Heathrow. So great, guys. It's been great to see you. Be well, eat well, read lots, and we look forward to meeting up with you again. 5 weeks, 22nd Feb. Diet and disease. We'll see you soon.